So now we'll talk. We'll talk about sclera. About the anatomy, it is a strong, opaque, not transparent as the cornea, white fibrous layer which forms about 5/6 of the external tonic of the eye. It's relatively avascular, therefore infections rarely affect it. If they do occur, they are chronic and sluggish. It is blue, it means thin, childhood, blue, thin. يعني السكليرا, if it's blue, it means that it's thin. In childhood and in pathological conditions where uvea shines through it. It may be yellow. The sclerostroma is composed of collagen bundles of varying size and shape that is not uniform. This is very important. This is the difference between sclera and cornea. And the collagens, as we mentioned, that is not uniformly oriented in a sclera, but they are uniformly oriented in the cornea. That's why the cornea is transparent, and that's why the sclera is not transparent. The inner layer of the sclera, lamina fusca, blends with the uveal tract. Anteriorly, the episclera consists of a connective tissue layer between the superficial sclerostroma and tenon capsule. This is very important now. It's around 1 millimeter thick. Sclera is thinnest, just posterior to the attachment of extraocular muscles. Thinnest area of the sclera is just posterior to the attachment of the extraocular muscles. And again, a normal sclera is around 1 all over, except in this area is around 0.3 millimeter. هذه the most common area of rupture, of the globe rupture. So anatomy, there are 3 sets of apertures, namely 1, anterior. We have anterior serial vessels, perivascular lymphatics, nerves. Middle, we have 4 vena vorticosal vortex veins, يعني, around 4 millimeter behind the equator. Posterior, we have the optic nerve, exit 3 millimeter to the medial side and just above the posterior pole. Then we have the long and short posterior ciliary vessels. Inflammations of the sclera, we can have just 2 main things, episcleritis or scleritis. Episcleritis is the superficial inflammation. Scleritis is the deep inflammation. Episcleritis, inflammation of the subconjunctiva. So just before we start, we have the conjunctiva. Below the conjunctiva, we have the episclera. Behind that, we have the sclera. So the episclera, inflammation is just below the conjunctiva. And episcleral tissue is known as episcleritis. It's almost benign in nature. غالبا يكون self-limiting. It disappears without any treatment. It's associated with other ocular, like rosacea, contact lens wear, or a systemic. It's very important to know اللي هو systemic involvement sclera والepisclera, especially اللي هو rheumatoid arthritis, الجاوت, اللي هي rheumatological diseases most likely تكون معها scleritis or episcleritis. Has been identified in up to a third of patients seen at tertiary centers in آخره. Types and then simple diffuse or nodular episcleritis. Anyway, symptoms تكون localized redness seen over sclera in nodular episcleritis, discomfort to pain, mild to moderate pain. Signs you can circumscribe nodule away 2 to 3 millimeters away from the nimbus. Is hard, immovable, وتندر. It's very important to know that it's tender. يعني with pressure إذا ضغطت عليها تكون painful للpatient. Not as conjunctivitis. Conjunctivitis no pain with pressure. إذا ضغطت على العين no pain. بينما الابيسكليراتس يكون very painful. مع يعني tender. Tender means pain with touch. The conjunctiva moves freely over the nodule, which means that the nodule is just below الconjunctiva. معناته الconjunctiva ما لها علاقة بالمشكلة. The conjunctiva looks purple in color as deep episcleral vessels traverse it. Of course, it's usually transient, lasting for several days or weeks. يعني غالبا self-limiting يعني تروح من نفسها after يعني several يعني a week or so. This is how it appears. This is the nodule. هذه النوديول. This is nodular episcleratus. يعني if you touch this area بتكون painful, tender يعني. This is how it looks. We can see that a deeper vessels يعني عندنا الآن superficial vessels اللي هي الconjunctiva ما لها علاقة. الconjunctiva بس كذا يعني مع المشكلة يصير لها congestion. But a deeper vessels اللي هي الداخلية هذه you can see that it's congested. It means that the episcleral vessels are involved. مشكلة في الابيسكليرا يعني. Complications, severe neuralgia. It can shift from episcleritis to scleritis, which is deeper infection, which is bad. Treatment, if mild, no treatment, just cold compressors, artificial tears, that's it. We can give topical steroids or oral non-steroidal anti-inflammatory drug like ibuprofen يعني. Scleritis is a bad form of episcleritis لأنها deeper everything is worse than episcleritis. Inflammation of the deep scleral tissue that can occur as anterior or posterior. Most likely anterior sclera الجزء الأمامي من السكليرا 95% or a posterior part of the sclera only 5%. Etiology is very important. 50% non-infectious. 50% of the cases non-infectious اللي هو ايش؟ inflammatory. Especially زي ما قلنا rheumatological diseases. Especially rheumatoid arthritis. Can appear with polyarthritis nodosa, with SLE اللي هو systemic lupus erythematosus, Wegener's, dermatomyositis, هذه كلها rheumatological diseases. So scleritis is always يعني almost always تكون مع إذا كانت non-infectious يعني تكون مع rheumatological disease, especially اللي هو rheumatoid arthritis. And it can be infectious like herpes or TB or syphilis. We have, as we mentioned, two types, anterior or posterior. Anterior can be diffuse scleritis, nodular scleritis, or necrotizing scleritis. Then we have posterior. And symptoms, as in يعني more painful, more redness, more tender. Localized redness is seen in the deep scleral tissue. In nodular scleritis, discomfort, mild to moderate pain is present. Pain is not mild. In the book is written mild to moderate. It's not mild. Moderate or more في scleritis. Signs in the diffuse scleritis, we can have multiple hard whitish nodules about the size of pinhead develop in the inflamed area of the sclera. They disappear without disintegrating. Nodular scleritis, one or more nodules are present. The swelling is dark, red or bluish at first, but later it becomes purple In necrotizing scleritis, there are large areas of avascular sclera leading to necrosis. Sclera may appear as a sequestrum of dead tissue. Necrotizing scleritis is very bad. It's serious condition. So this is the scleritis. يعني from here you cannot, from the first look, you cannot differentiate between episcleritis or scleritis. You can't. It's very, very difficult to differentiate between episcleritis or scleritis. However, here هذه تبعيات السكليرايتس. This will not happen in episcleritis. لأن السكليرايتس can cause thinning. يعني after ما يخلص الانفلاميشن will cause thinning of the sclera. فتظهر السكليرا بهذا الشكل. هذه الاريا this area هذه الاريا يكون فيها thinning. هذه الاريا it means that there is thinning here in the sclera. This is because of the inflammation. After the inflammation ends, it can cause thinning like this. يعني this area اللي هو البلوش لأنه قاعد تشوف اليوفيا، قاعد تشوف الاريا اللي تحتها. Here is very severe thinning. Very thin sclera. خلاص يعني even here خلاص يعني شوي you will just enter اليوفيا. اللي هو الكورويد. يعني اليوفيا is what? What's يوفيا? يوفيا is iris, sclera body, and choroid. These three are the uvea, but here is the choroid. يعني you are seeing the choroid now. And the sclera is very thin. The investigations, يعني because it's mostly systemic. ESR, erythrocyte sedimentation rate, rheumatoid factor, so very important, anti-nuclear اللي هو ANA, plasma protein, immunoglobulin, uric acid for gout, serologic tests for syphilis, tuberculin test for TB, chest X-ray, hand, feet, and lumbosacral spine, fluorescein angiography for vasculitis. يعني هي systemic mostly. السكليرايتس. الكومبليكيشنز ايرايتس اللي هو الانفلاميشن اوف ذا ايرس، سايكلايتس اللي هو انفلاميشن اوف ذا سيليري بادي، كورويدايتس اللي هو انفلاميشن اوف ذا كورويد، annular scleritis. There is a ring shaped involvement of the sclera, changes in the cornea, can secondary glaucoma can happen as a result of uveitis اللي هو inflammation of the uvea, ciliary staphyloma اللي هي scleral thinning زي هذه scleral thinning اللي هي اللي ذكرناها تو. Scleromalacia perforans is a necrotizing scleritis without inflammation. There is exposure of the uvea but no pain. And I will show you a photo. And the sclera is completely gone in very extreme case. Massive granuloma of the sclera. Differences between episcleritis and scleritis. Corneal and uveal tract involvement. Everything is absent in episcleritis and everything is there in scleritis, especially in severe scleritis. Iritis, cyclitis, associated with serious staphyloma, sclera becomes thin for scleritis. This will not happen with episcleritis. يعني, as I mentioned in the beginning, scleritis is a severe form of episcleritis. لأنها deeper. Scleritis is deeper involvement. Sclera بينما episcleritis is superficial. Only the episclera is involved. Scleritis عندنا medical treatment has an episclera episcleritis. يعني we can use topical steroids for mild cases of scleritis. Topical steroids will do. Oral NSAIDs نفس الإيبوبروفين again can do. We can use systemic steroids, not only topical. We can use systemic steroids for scleritis, but you should rule out what? You should rule out infection first. Then we can use cytotoxic immunosuppressive drugs اللي هي something more than systemic steroids like cyclophosphamide. طبعا هذه تكون systemic. Surgical treatment يعني is very extreme. يعني you can just cover the area إذا كانت thin is very difficult. Extreme sclera thinning or perforation require reinforcement. Donor sclera or cornea may be used, but they usually swell and with edema and so on. Extreme corneal marginal ulceration or keratolysis may require cornea grafting إلى آخره. يعني surgical treatment is somehow advanced. Just cover the area. This is very صراحة difficult. Now this is very extreme case of scleritis. The sclera is almost melted away. That's it for the sclera. Any question? Is it usually start as episcleritis? No. Episcleritis can shift to scleritis, but is it always the case? No. It begins as scleritis على طول. But with time, episcleritis sometime يعني can shift to scleritis. Yes. Any other questions?
السلام عليكم.
وعليكم السلام.
تمام. طيب دكتور regarding the next
regarding the next is the thinning of the sclera reversible? No, it's not reversible. Any question يا شباب؟
يعطيك العافية.
يعطيكم العافية، بالتوفيق.
شكرا لك.
حياكم الله، أهلا وسهلا.